You feel fine. That is what makes this so insidious. You go about your days without pain, without obvious symptoms, without any indication that something fundamental has shifted inside your body. Perhaps you're a bit more tired than you used to be, but who is not? Perhaps you notice you're urinating more often at night, but you attribute that to age or the cup of tea before bed. Perhaps your ankles seem slightly puffy by evening, but you have been on your feet all day. Everything has an explanation. Nothing demands attention. Then you go for a routine checkup. Blood is drawn. Numbers are calculated. Your doctor returns with an expression you have not seen before, a careful neutrality that precedes difficult news. Your kidney function, measured by something called the estimated glomerular filtration rate, has dropped to 30% of normal. You have lost 70% of your kidney capacity, and you had no idea anything was wrong. This scenario unfolds every day in clinics around the world. Kidneys fail in silence. They decline without protest. They lose the majority of their function while their owners feel essentially normal. By the time symptoms become obvious enough to prompt investigation, the damage is often severe and sometimes irreversible. The body that seemed fine was quietly deteriorating in ways that escaped notice until a laboratory test revealed the truth. I want to explain what actually happens inside your body when kidney function drops this dramatically. Not abstract numbers and medical terminology, but the concrete physiological changes that transform how every system operates when these essential organs can no longer do their job properly. Understanding these changes reveals why certain symptoms appear, why others remain hidden until late stages, and what can be done to slow progression before dialysis becomes the only option. Let me begin with why kidney decline is typically silent, because this paradox deserves explanation. Pain exists to warn us of damage. When you cut your finger, nerves send signals that demand attention. When your heart is stressed, chest pain may alert you, but the working tissue of the kidney, the nephrons that perform the actual filtration work, contains no pain-sensing nerves. You could lose millions of nephrons and feel nothing, because the tissue doing the work has no way to announce its destruction. Pain from the kidney area does occur, but it signals problems with surrounding structures rather than the filtering tissue itself. The capsule surrounding each kidney can sense stretching. The tubes draining urine, the ureters, can sense obstruction. The pelvis, where urine collects, can sense infection. These structures have pain sensors. The nephrons do not. This explains why kidney stones produce such dramatic pain, while chronic kidney disease produces none. A stone forming quietly inside the kidney causes no discomfort until it moves into the narrow ureter, stretching and obstructing a tube that very much can sense what is happening to it. The pain arrives in waves, severe and unmistakable, often described as among the worst pain a person can experience. It moves as the stone moves, radiating from back to abdomen to groin as the crystalline fragment makes its journey toward the bladder. Kidney infections produce a different kind of pain, deep and steady rather than wave-like, centered in the back below the ribs. This pain reflects inflammation of the pelvis and surrounding tissue, structures that can communicate distress. The infection brings fever, chills, nausea, the classic signs of a body-fighting invasion. You know something is wrong because the pain and systemic symptoms demand acknowledgement. Polycystic kidney disease, a genetic condition where fluid-filled cysts gradually enlarge the kidneys, produces yet another pain pattern. As the kidneys expand over years, they press against surrounding structures, creating a chronic pressure-like discomfort that worsens as the cysts grow. The pain reflects the physical enlargement stretching tissues that can sense it. But chronic kidney disease, the gradual loss of nephrons from diabetes, hypertension, or other causes, occurs in tissue that cannot feel. Millions of filtering units are destroyed. Function declines year after year. And you feel nothing, because there is nothing to feel. The silence is not a gift. It is a trap. When kidney function has dropped 70%, you have approximately 30% of your original capacity remaining. The nephrons that survive are working harder to compensate, handling the load that was once distributed across far more tissue. This compensation explains why function can decline so far without obvious symptoms. The remaining nephrons push harder. For a while, they manage. But they are overworked and under strain, and the compensation cannot continue indefinitely. What exactly are the kidneys no longer doing properly at this level of function? The answer involves multiple systems that depend on kidney performance for their own operation. Waste removal is the most obvious function affected. Your cells produce metabolic waste constantly, byproducts of protein breakdown, cellular activity, and detoxification processes throughout the body. The kidneys filter these wastes from the blood and excrete them in urine. When filtering capacity drops 70%, waste clearance drops proportionally. Substances that should be eliminated accumulate in the bloodstream. Urea and creatinine are the wastes commonly measured, but they represent only markers for a broader category of retained toxins. As these substances build up, they affect how you feel and how your body functions. The fatigue that seems disproportionate to your activity level, the mental sluggishness that makes thinking feel effortful, the general sense of not being quite right, these reflect toxins circulating in blood that should be clear. Your brain, your muscles, your every cell bathes in fluid that is more contaminated than it should be. The cognitive effects deserve particular attention because they are so easily misattributed. You assume you're tired from work, from poor sleep, from stress. You assume your difficulty concentrating reflects the modern condition of too many demands and too little focus. You do not suspect that your kidneys are failing to clear the waste products that cloud your thinking. The mental fog seems like life, not like organ failure. Fluid balance regulation fails progressively as kidney function declines. Your kidneys should adjust how much water and sodium you retain based on your intake and your body's needs. When function drops, this regulation becomes imprecise and then frankly impaired. Sodium that should be excreted is retained. Water follows sodium. Fluid accumulates where it should not. The swelling that results follows predictable patterns determined by gravity and timing. In the morning, after hours lying flat, the retained fluid distributes across the body, often pooling in loose tissue around the eyes. You notice puffiness in your face, particularly around your eyes, that seems excessive for normal overnight fluid shifts. As the day progresses and you assume an upright position, gravity pulls the fluid downward. By evening, your feet and ankles are swollen, your shoes tight, your skin leaving impressions where elastic pressed against it. This edema reflects sodium and water retention from kidneys that can no longer regulate properly. But it also reflects protein loss that compounds the problem. Healthy kidneys retain proteins in the blood, preventing their escape into urine. Damaged kidneys allow proteins to leak through their compromised filters. The protein that escapes is primarily albumin, a molecule that holds fluid inside blood vessels. When albumin drops, fluid leaks from vessels into surrounding tissue more readily. The swelling worsens from both mechanisms. Too much fluid retained and too little protein to keep it where it belongs. Urine itself changes in ways that provide clues if you know to look. The frequency of urination may increase, particularly at night. Healthy kidneys concentrate urine effectively during sleep, reducing nighttime bathroom trips. Damaged kidneys lose this concentrating ability, producing more dilute urine that requires more frequent emptying. The trips to the bathroom at 2 and 4 and 6 in the morning, which you attributed to aging or prostate issues or simply bad luck, may actually reflect kidneys that cannot do what they once did. The appearance of urine changes too. Foamy urine with bubbles that persist rather than quickly dissipating indicates protein in the urine. The foam resembles what you see when washing dishes with soap, persistent bubbles created by the surface active properties of protein. Not everyone with kidney disease notices foam, and not all foam indicates kidney disease, but persistent foaminess warrants investigation. The colour and clarity of urine provide additional information. Dark urine despite adequate hydration suggests concentration problems. Cloudy urine may indicate infection or abnormal content. Changes in smell can reflect metabolic changes that alter urine composition. These are not signs people typically monitor, but they become meaningful when kidney function is questioned. Blood pressure elevation accompanies kidney decline in a vicious cycle that accelerates damage. Healthy kidneys regulate blood pressure through multiple mechanisms. They control sodium and fluid balance, directly affecting blood volume. They produce hormones that constrict or dilate blood vessels. They respond to blood pressure by adjusting filtration. When kidneys are damaged, these regulatory systems fail. Sodium accumulates, fluid accumulates, blood volume rises, blood pressure rises. But elevated blood pressure is not merely a consequence of kidney damage. It is also a cause of further damage. High pressure within the delicate filtering structures of the kidney causes additional injury. The remaining nephrons, already overworked, now face mechanical stress that accelerates their decline. Pressure that damages leads to damage that raises pressure. The cycle feeds itself. each turn making the next turn worse. This is why blood pressure control is so critical in kidney disease, not merely as a cardiovascular concern but as a direct protection for remaining kidney function. Every point of blood pressure reduction provides benefit to the kidneys struggling to survive. Every failure to control pressure allows the cycle to continue its destructive spiral. The kidneys produce a hormone called erythropoietin that stimulates bone marrow to produce red blood cells. When kidney function drops, erythropoietin production drops correspondingly. Bone marrow receives weaker signals. Red blood cell production slows. Anemia develops. The symptoms of anemia are non-specific and easily attributed to other causes. Fatigue, again, which you already experienced from toxin accumulation, now worsens from reduced oxygen carrying capacity. Feeling cold when others are comfortable reflects reduced blood flow as the body compensates for fewer red blood cells. Shortness of breath with minimal exertion reflects inadequate oxygen delivery to muscles that demand it. Pale skin, brittle nails, weakness beyond what seems reasonable, all can reflect the anemia that accompanies significant kidney decline. The combination of toxin accumulation and anemia creates a multiplicative effect on energy and cognition. You are tired because waste products cloud your system. You're tired because you cannot carry enough oxygen to your tissues. The two causes compound each other into a fatigue that seems disproportionate to anything you can identify. You wonder if you're depressed, if you're not sleeping well, if something is wrong that you cannot name. Something is wrong. Your kidneys are failing. Mineral balance regulation, another kidney function, becomes increasingly problematic as function declines. Calcium, phosphorus, potassium, sodium, and other minerals must be maintained within narrow ranges for proper physiological function. The kidneys manage these balances through selective retention and excretion. When this management fails, mineral levels drift outside normal ranges with consequences throughout the body. Phosphorus elevation is particularly significant because it produces symptoms that patients notice. Elevated phosphorus in the blood contributes to the intense itching that many people with advanced kidney disease experience. The itching is not localized. It seems to come from within, impossible to scratch effectively, relentless and maddening. The skin itself may become dry and flaky as mineral imbalance affects its health. The itching worsens at night, interfering with sleep that is already disrupted by other consequences of kidney failure. Potassium elevation becomes dangerous at extreme levels, affecting heart rhythm in ways that can be lethal. The kidneys normally excrete excess potassium efficiently. When this excretion fails, potassium accumulates. At mildly elevated levels, you may notice nothing. At significantly elevated levels, cardiac conduction is affected. Arrhythmias develop. Sudden cardiac death can occur from potassium levels that were not recognized as dangerously high. The taste changes that accompany advanced kidney disease reflect the metabolic chaos occurring internally. A metallic taste persists in the mouth, altering the experience of food and making some foods unpleasant that once were enjoyed. The breath develops an unusual odor, sometimes described as ammonia-like, that reflects the breakdown of accumulated urea in saliva. Brushing teeth does not resolve it, because the source is not in the mouth, but in the blood that supplies the mouth. You taste what is in your blood, and what is in your blood has changed. Appetite often diminishes as kidney function declines, compounding nutritional challenges that disease creates. The metallic taste makes food less appealing. The general malaise reduces interest in eating. Nausea may develop as toxins accumulate. Weight loss can occur despite adequate food availability, as the body consumes itself in the setting of metabolic derangement. Sleep becomes increasingly disturbed through multiple mechanisms. The need to urinate frequently wakes you repeatedly. The itching intensifies at night. Restless legs, a condition characterized by uncomfortable sensations in the legs and an irresistible urge to move them, occurs commonly in kidney disease, likely related to toxin accumulation and mineral imbalance affecting nerve function. The brain, bathing in contaminated fluid, does not achieve the deep sleep stages that restore and refresh. You spend hours in bed but wake unrestored. The stress response is amplified as the body struggles with the consequences of kidney failure. Cortisol levels may rise, sympathetic nervous system activation increases. The constant internal stress of managing a failing organ affects the systems that should promote calm and recovery. Sleep suffers. Blood pressure rises further. The cascade continues. Now let me explain what causes kidneys to reach this state. because understanding causes points toward prevention. The two most common causes of chronic kidney disease are diabetes and hypertension, both conditions that damage the delicate filtering structures through prolonged metabolic and mechanical stress. Diabetes damages kidneys through multiple mechanisms, but elevated blood sugar is central. The small blood vessels that supply the nephrons become damaged. The filtering membranes become abnormally permeable. The tissue itself is harmed by the toxic effects of chronically elevated glucose. Over years, this damage accumulates until enough nephrons have been destroyed that function measurably declines. The connection between diabetes and kidney disease is so consistent that diabetic nephropathy has become the leading cause of kidney failure requiring dialysis in developed countries. The epidemic of type 2 diabetes has become an epidemic of kidney disease, with each patient who develops poorly controlled diabetes at risk for eventual kidney failure if they live long enough for the damage to accumulate. Hypertension damages kidneys through mechanical stress. The filtering units of the kidney experience blood pressure directly. When that pressure is chronically elevated, the delicate structures are injured, scarring develops, function declines. The relationship is dose-dependent. Higher pressures cause faster damage, lower pressures cause slower damage. Control of blood pressure is directly protective. The feedback loop I described earlier means that hypertension and kidney disease become intertwined once either develops. Hypertension damages kidneys, damaged kidneys worsen hypertension. Breaking this cycle requires aggressive blood pressure management, which becomes progressively more difficult as kidney function declines, and the kidneys lose their ability to help regulate pressure. Other causes of kidney disease include glomerulonephritis, various forms of inflammation affecting the filtering units, polycystic kidney disease, the genetic condition I mentioned earlier, recurrent kidney infections that scar tissue, obstructions that back up pressure into the kidneys, and toxic exposures including certain medications. The medication risk deserves emphasis because it involves choices people make regularly without understanding the consequences. Non-steroidal anti-inflammatory drugs, the pain relievers available without prescription in every pharmacy, can damage kidneys when used frequently or in high doses. Occasional use in healthy individuals poses minimal risk. Regular use over years, particularly in people with other kidney risk factors, can contribute to progressive damage. The accessibility of these medications creates assumptions about their safety that are not warranted. People take ibuprofen daily for chronic pain without realizing they are stressing organs that may already be compromised. They layer multiple anti-inflammatory products without understanding that they are amplifying the kidney burden. The pain relief seems worth the invisible cost until the cost becomes undeniable. Certain supplements and herbal products also pose kidney risks that their natural origins tend to obscure. The assumption that natural means safe leads people to consume products that concentrate compounds in amounts the kidneys struggle to handle. Some traditional remedies contain nephrotoxic substances. Some high-dose supplements overload elimination pathways. The kidneys bear the burden of everything that enters the bloodstream, including substances consumed in pursuit of health. If you have reached the point where 70% of function has been lost, what can be done? The damage that has occurred cannot be reversed. Nephrons that have been destroyed do not regenerate. The scarred tissue does not heal. But progression can be slowed, sometimes dramatically, through aggressive management of the factors that continue to drive damage. Blood pressure control becomes paramount. Every reduction in pressure reduces the stress on remaining nephrons. Medications, lifestyle changes, sodium restriction, weight management, whatever it takes to bring pressure down protects what function remains. The targets are lower than for people with healthy kidneys because the stakes are higher. Blood sugar control, if diabetes is involved, directly affects the rate of further decline. The damage from diabetes is cumulative. Every day of poor control adds to the burden. Every improvement in control slows the accumulation. The strictness required feels burdensome, but the alternative is progression toward dialysis. Dietary modifications become necessary as kidney function declines. Protein intake, which generates waste products the kidneys must clear, may need to be moderated rather than maximized. Sodium must be restricted to help manage fluid balance and blood pressure. Potassium must be monitored as the kidneys lose their ability to excrete it safely. Phosphorus must be managed to prevent the mineral imbalance that causes itching and bone disease. These dietary restrictions are not arbitrary. They reflect the reality that kidneys with 30% function cannot handle the dietary load that healthy kidneys manage effortlessly. The adjustments compensate for what the kidneys can no longer do. preventing the accumulation that would otherwise occur and buying time before dialysis becomes necessary. Avoiding further kidney toxic exposures becomes critical. The NSAIDs must stop. The risky supplements must stop. Any medication must be evaluated for kidney impact and adjusted as needed. The remaining nephrons are precious and irreplaceable. Nothing should be allowed to stress them unnecessarily. Detection of kidney decline before it reaches this stage is possible through simple testing that is often not performed until too late. Standard blood panels include creatinine, from which estimated filtration rate is calculated. Urine testing for protein, particularly the albumin to creatinine ratio, can detect early damage before filtration even drops significantly. Protein leakage often precedes filtration decline, making it an early warning that standard tests miss. The tragedy is that these tests are available, affordable, and often not ordered until symptoms demand investigation. People at risk, those with diabetes, hypertension, family history of kidney disease, regular NSAID use, should be screened regularly even when feeling fine. The fine feeling cannot be trusted. The kidneys do not warn. Metabolic health emerges as a foundational concern that underlies much of what goes wrong. Insulin resistance, the condition where cells respond poorly to insulin and blood sugar remains elevated, stresses kidneys even before frank diabetes develops. The inflammatory state that accompanies metabolic dysfunction contributes to vascular damage throughout the body, including in the kidneys. Addressing metabolic health through diet, exercise, weight management, sleep and stress reduction provides protection that no medication can fully replicate. Inflammation deserves attention as a driver of progressive damage. Chronic low-grade inflammation, the kind that accompanies obesity, poor diet and sedentary living, contributes to kidney injury through multiple pathways. Reducing inflammation through lifestyle modification may slow kidney decline in ways that complement other interventions. Hydration requires balance rather than excess. The advice to drink large amounts of water is not appropriate for everyone. People with functioning kidneys can handle substantial fluid intake. People with compromised kidneys may be harmed by fluid loads they cannot clear. Urine colour provides a rough guide. Pale yellow suggests adequate hydration. Dark yellow suggests dehydration. Clear suggests possible overhydration. But the guide becomes less reliable as kidney function declines and concentrating ability is lost. Living with 30% kidney function is not the same as living with healthy kidneys, but it is not the same as being on dialysis either. Many people live for years at this level of function, managing the consequences through medication, diet, and lifestyle while monitoring for further decline. The goal becomes preservation, protecting what remains, slowing progression, delaying the day when external kidney replacement becomes necessary. Dialysis represents the endpoint that aggressive management tries to avoid or postpone. When kidney function drops below approximately 15%, the accumulation of waste and fluid becomes unmanageable through any other means. Dialysis, whether through hemodialysis that filters blood through a machine or peritoneal dialysis that uses the abdominal lining as a filter, takes over the work the kidneys can no longer perform. Dialysis saves lives that would otherwise end from the toxic accumulation of kidney failure, but it is burdensome, time-consuming, and imperfect. It replaces some kidney functions, but not others. People on dialysis typically feel better than they did before starting, but not as well as they would feel with functioning kidneys. The goal of everything that precedes dialysis is to avoid or delay reaching that point. Kidney transplantation offers another path for those who reach end-stage disease, providing function that dialysis cannot match. A functioning transplant restores what disease destroyed, returning life to something closer to normal. But transplants require suitable donors, major surgery, lifelong immunosuppression, and carry their own risks and limitations. They are solutions to a problem that prevention would have avoided. The person sitting in that clinic hearing for the first time that 70% of their kidney function has silently disappeared faces a path that will be difficult but is not hopeless. Aggressive management can buy years. Lifestyle modifications make genuine differences. The symptoms that have emerged can be managed. The progression that seemed inevitable can be slowed. But the lesson for everyone else is to not wait until reaching that chair. Kidney function should be screened in anyone with risk factors. Diabetes should be prevented or aggressively controlled. Blood pressure should be managed early. Metabolic health should be prioritized through the lifestyle factors that support it. The kidneys that silently perform their essential work deserve protection they often do not receive. The organs that filter your blood, balance your fluids, regulate your minerals, produce essential hormones, and contribute to blood pressure control are vulnerable to damage that they cannot communicate. The silence is not wellness. The silence is simply the absence of pain, signals from tissue that cannot generate them. Understanding what happens when kidney function drops dramatically makes the case for prevention and early detection. The fatigue, the swelling, the blood pressure, the anemia, the itching, the taste changes, the sleep disruption, all the consequences of advanced kidney disease are consequences that did not need to occur. They represent decades of damage that accumulated while the person felt fine, that could have been detected and slowed had anyone thought to look. Your kidneys are working right now, filtering your blood, maintaining your balance, performing functions you never consciously appreciate. They ask nothing except that you not poison them with nephrotoxic substances, not stress them with uncontrolled blood pressure and blood sugar, not ignore the risk factors that predict their decline. In return, they continue their silent work, keeping you alive in ways you take for granted until they cannot anymore. This 70% loss that produces symptoms was preceded by 40% loss that produced none, by 20% loss that went unnoticed, by early damage that simple tests could have detected. Each stage could have been a moment of intervention, a point where aggressive action changed the trajectory. Instead, the silence continued until the silence could no longer hide what had happened. Let this understanding motivate the testing, the prevention, the attention that your kidneys deserve but rarely receive. Let the knowledge of what happens when function drops dramatically inspire the actions that prevent reaching that point. The kidneys cannot speak for themselves. Someone must speak for them, must demand the screening and protection that these essential organs require. That someone is you.